All right, so the geriatric population is considered to be age 65 and above, and because of a person's aging and body changes, more drugs tend to be taken at this particular time. So of course those body processes are going to be affected there. Absorption is going to be different because many things slow down. There's a change in all through the GI tract, less blood flow, slowing down of bowel motility, and that's going to affect absorption. Distribution, when there is, in somebody who's elderly and doesn't really watch their intake and exercise, we tend to put on body fat more rapidly and decrease our muscle mass. So that's going to cause a decrease in, that's going to affect our serum proteins like albumin. So that's going to affect drug binding. If you are taking a drug that has a real affinity for body fat and you put on a great deal of body fat while you are staying with the same dosage, it can stay in your body longer than it did when you didn't have as much body fat. Usually, elderly people have a decline in their body water, and they tend not to drink. They tend not to be as thirsty as a younger person, and so sometimes you can end up with a toxic drug buildup in the elderly. Metabolism is affected because there are a lot of changes in the liver. You might not have as much blood flow, the liver gets smaller, the liver enzymes are not produced in as great amounts. And if you end up with an actual liver disease, that can keep the liver from doing anything it's supposed to. Now, all of these body changes I'm talking about, all of them aren't going to happen to every elderly person. You might have an elderly person with a lot of body fat, but they've got the liver of a 30-year-old, and so they do fine with their metabolism. Not saying all these things are going to happen. But they are just more common and come on gradually as a person ages. Elimination, there's usually a change in kidney function. You have fewer nephrons than you did, a decrease in blood flow to the kidneys, and the glomeruli don't filter substances out the way they did. And if you have actual kidney damage, kidney disease, the blood flow can be reduced to the kidneys, by half, and so that's going to really, really affect elimination as well. And drug metabolites are going to build up in the system and have to be removed in the process of dialysis. Polypharmacy refers to taking a large number of medications, and this is a lot more common in the elderly. And those of you who work in facilities, you see how many meds a lot of these older folks take. They can take, 5, 10, 15, 20 meds that the nurse is having to pass out. And the higher the number of meds, the much greater chance of drug interactions. There has to be a lot of patient teaching done for people who are elderly. On page 31, your textbook talks about that. There are a lot of reasons why patients may not take their medications as they age. Drugs become very costly, usually at a time when you have a fixed income. Maybe an older person is not able to drive or run errands the way they were, so they have a hard time even getting to the doctor or picking up meds. They might not really remember a medication or the need to take it as often. Sometimes you're just plain tired. It's like, I am 80 years old and I am sick of learning new things. I just want to relax. They don't have the desire to even start a new program of medication or health. Sometimes they feel depressed and they just don't feel good. They're overwhelmed by their existing health problems. Sometimes there are physical issues. If you've got severe arthritis that's causing pain in your hands, you don't want to be, opening a bunch of medicine bottles. You might not be able to see as well, so the small print on these bottles can be difficult. And sometimes you'll see an older adult adjusting their med dosage because it costs so much. They have to pay $50 a month for their blood pressure medicine. So they're like, well, I'll just take it every other day and then it'll last me 2 months and that'll save me money. I had that issue with my mother. My mother lives next door to me. She is 79, but she is a very young, healthy 79, thank God. But occasionally she'll talk about, I couldn't get out to the store, and I wasn't going to have money until I got my pension check this month, so I just took the med every other day, and I was like, do not do that. You cannot do that. It won't work. But you'll see that with a lot of elderly folks, and it's pitiful. It really is. There are a lot of considerations that we have to think of when it comes to pregnancy and breastfeeding. And these are discussed a little bit on page 32 also. It is very, very important always with medication administration to weigh what we call the benefit-risk ratio. If the benefits are higher than the risks, then that's one thing. And it's enough of a consideration when it's just you, but when it's you and your fetus, it's very, very important. And really, every drug has a risk-benefit ratio. And generally, we try to go with, high benefit, low risk, or the benefits outweigh the risks, so we'll take it. But that's always something you have to think of. I'm going to briefly talk about a drug that did a lot of damage back in the late 50s and early 60s. This is a drug called thalidomide. Thalidomide was a sedative. It was used as a sleeping pill, and it had a tremendous ability to relieve severe morning sickness. Unfortunately, thalidomide did not show any problems when it was given to pregnant animals. Sometimes you give a drug to like a pregnant rabbit or a pregnant dog, and all the babies are born abnormal, and okay, this drug is teratogenic. Teratogenic means it has the possibility of causing damage to a fetus. Well, it didn't happen when they tested thalidomide on mice and rats and whatever they tested them on. And so they went ahead and considered it safe to give to pregnant women. Well, unfortunately, these babies were born with severe birth defects because of thalidomide. I have a movie that I want you to watch. It's a YouTube movie. And I want you to watch it after this. I'm going to give you the link, and I want you to watch it after this lecture is complete. But thalidomide is constantly being referred to when people talk about the risks of drugs, because in testing, it really didn't show the great risk, and the adverse effects were devastating. Remember that a fetus has an immature blood-brain barrier if something is able to pass through the placenta, and so things that wouldn't affect an older child might not have an effect on the fetus. And one of these is alcohol. Alcohol can do a lot of damage to a fetus if taken in during pregnancy. Drugs can be excreted into breast milk. So that's another way that your body can get rid of medications. And if you are nursing, the drug might be considered harmless to a nursing mother, but then again, it might not. So there are a lot of places that you can check to see if a drug has particular toxicity. And this is one of them. This is a National Institute of Health's website where you can look at possible toxic effects on nursing infants. But definitely moms should talk to their healthcare provider, their OB and their pediatrician. When we are looking at pregnancy categories, the FDA has set up a drug risk classification going from A to X, and these are the result of long years of study in these medications. If a drug is category A, according to the FDA, they've done controlled studies in humans, and they have not shown any risk in people who were pregnant, maybe who didn't know they were pregnant before, or in actual use by a pregnant woman. B They haven't done controlled studies, but just from observing pregnant women taking it, they haven't seen any problems, and animal studies show no risk of the fetus. But remember, thalidomide, the greatest teratogenic we've seen in recent history, had no animal studies that showed risks. C means they haven't done controlled studies. They might have just observed through the years that as pregnant women took these medications, they did fine and their babies had no problems, but they can't say for sure. D, there is a risk to the fetus, but benefits can outweigh the risks in certain situations. And then if something is a category X, that means that both human and animal studies have shown fetal abnormalities, and the risk in pregnant women outweighs any benefits that there could possibly be. Thalidomide is still used in certain cases for certain conditions, but the improvement that it might make in these conditions are, far too risky to compare to the awful things that can happen. So thalidomide, definitely a category X drug, and a number of other drugs that we'll talk about are considered category X. Accutane for severe acne, absolute contradiction in pregnant women, and you have to go through all sorts of hoops if you want to take isotretinoin or one of the generic forms of Accutane because of the severe damage that can be done to a fetus.